I'm Dr. Amol Gupta, and I want to thank you for joining me on another episode of Medicine Mentors, where we interview masters in medicine, leading physicians at the top universities across the United States to learn from their experiences and derive key insights, traits, and best practices that can guide medical students and residents. Today, we're speaking with Dr. Rahma Warsame. Dr. Warsame is a consultant in the Division of Hematology Oncology and an assistant professor of medicine at Mayo Clinic. Dr. Warsame's research focuses on amyloidosis and multiple myeloma. She's also interested in investigating existing healthcare delivery systems to improve patient-reported outcomes and quality of life. She's working on incorporating patient perspectives systematically and efficiently in the clinical practice and determining its effects on clinical outcomes with the goal of developing a system that can provide patients with truly individualized care. Thank you so much, Dr. Warsame, for giving us an opportunity to learn more about your life story and experiences.
Well, thank you for inviting me.
Dr. Warsame, I'd like to take you back into your childhood. Who were some of the role models that you had early on in life? And what were some of their life lessons that have stayed with you through your journey in medicine?
Well, my family was a refugee family from Somalia, and I think that influence of immigrating to Canada with my mother and subsequently my father and my siblings was a very impactful experience. I would say my mother and my father and their tenacity, their adaptability, and their deep belief in kindness really had an impact on the person I am today, to aspire for education, knowledge, and to ensure that you always pay it forward to others.
You talked about kindness, and I want to pause on that word for a minute. It seems to be something which is lacking today in medicine. What does kindness mean to you, and how do you use it in your everyday practice?
Kindness begets kindness. I went into medicine for multiple reasons, but the reason I became a hematologist or a cancer doctor particularly was a result of helping a good friend of mine navigate her lymphoma diagnosis. And she had an excellent hematologist who was critically and very successful, well-published, productive, an investigator. However, I would say lacked as much kindness as I believe we would have benefited from. When she died, we, her family, her friends, remembered the people who were kind in her healthcare journey more than those who were knowledgeable. And that stuck with me my whole life. And it's really been my guiding light. I think knowledge can be acquired, success, hard work, much can be taught, but I really think a deep respect for kindness begets healing and is essential for going from a great physician to an incredible physician.
You know, I've always heard good to great, but today you've taken it from great to incredible. You're a first generation in the United States, and you've reached Mayo Clinic, one of the best universities in the country. Can you share with us some of the challenges that you faced as you navigated this journey and how you dealt with them?
So being an immigrant, being a Black woman, and moving to the United States and aspiring to one day work at an institution as well regarded and really a beacon of knowledge and kindness, which is how Mayo Clinic was developed, with the Mayo brothers and their father coming to a place that had a tornado. I think the greatest challenges I faced were unexpected discrimination for things I could not control. So perpetually proving that I was capable and that I deserved to be in the spaces that I was. It's not uncommon that I am the only person of color or Black person or Black woman in a room. And with that comes a certain responsibility and to ensure that you are well received so you can pave a road for others and ensure that mistakes that you make that would be typically disregarded don't result in barring others from their success. And I think also I'm a foreign medical grad. That adds an extra level of scrutiny and credibility you need to earn.
Many of the people who are listening on to this podcast are foreign medical graduates, and it's very common to think that there are certain places that foreign medical graduates simply can't get in. I'd say Mayo Clinic would probably be on that list. But when you sought out and started this process, what was your vision? How did you achieve what seemed to be impossible to many other people who are in your graduating class?
I would say that I always felt like if someone else could do it, then there's at least a chance that I could do it. And I also had the benefit of always looking backwards. I had already achieved so much relative to where I began and definitively relative to where my parents began. And so I always felt that you should swing for the fences because you have nothing to lose.
I want to talk to you a little bit about success. I mean, you've been very successful as a first generation immigrant, a Black woman, now a hematologist at Mayo Clinic. How do you define success?
My definition of success continues to evolve. But I think to its fundamental basics is success was for me was to be able to achieve this dream and to be able to have a fulfilling career where I impact other human beings in a meaningful and substantial way. Whether it's simply in that clinical space, in that room where it's just you and the patient and their family, or if it's on a larger scale, advocating for those with lower socioeconomic status, diversity, more equity. It's really about being authentically yourself while achieving and having a fulfilling career. So just making sure I had an impact. I didn't want to feel like I was just going through the motions and looking for privilege, status, and success.
The way we see it sometimes, as students is, well, once you're on the other side, you're going to talk all these great things that, yeah, it's really not about publications and board scores, and it's actually all about the patient and those higher virtues of being an evolved human being. But backtrack and imagine that you're a student, right? And now you're listening to Dr. Warsame talk about all these great qualities, and you're like, okay, but I mean, I really don't stand a chance if I don't have all these things. So how can I incorporate those higher values into what I'm doing today? And will it actually help me be better at what I'm doing if I've invested time into developing and understanding some of these values?
Don't worry, I was just like that. So first of all, I lived by 3 rules: never be late, never lie, never be lazy in medicine, and show up and bring all of your enthusiasm, your effort, and be prepared to work hard. I also have found what has been very beneficial to me is I was open to be vulnerable when I did not know something. I have found that if you try to figure something out, but you don't, you're struggling. I have been much more successful throughout all of my training, my medical school years, even in undergrad, with asking for help. It doesn't mean that you didn't try to figure it out. That's critical. You can't just ask everybody to spoon feed you, but you do have to be okay with being wrong when you're in rounds and being open to a different diagnosis or a different direction or doing something differently. I also always asked, what did you expect of me at the beginning of everything? Any rotation, clerkships, and I asked for feedback, mid-feedback. Whether I was with someone for a week, it would be on Wednesday. If I was with someone for a month, it would be 2 weeks in, because I didn't want to find out at the end what I was doing wasn't meeting their expectations. So right at the beginning, I asked for expectation setting, and then I asked for what my deficits were, and then I fixed them, whatever it is, even if sometimes I didn't really agree. I was like, I don't think I do that, or I think that's semantics, but it shows effort and it shows that you respect the experience of the person who's taking the time to tell you.
You touched on something that's been brought up in a lot of interviews I've taken about being vulnerable, being open to accepting that you're wrong. And it seems to be difficult, especially when you're trying to create a level playing field, trying to show people that you're smart, you're able. Where did you find the courage to say, I don't know this?
I think it came from my parents. When you see people start with nothing and lose everything. So it's not that they weren't educated, their education wasn't acknowledged. They had to restart. They had 4 children and 1 on the way. And when you see that type of courage, it's not very hard to be okay with being wrong because you're already proud of where you've achieved. Just simply getting here was amazing. Going to college was amazing. It didn't mean, though, that I didn't work. I made sure that if there was something I should know, I'll know it. I will study it. You mentioned it. I didn't really understand it. I went home and I read about it and I came back. And if I read about it and I still didn't understand it, then I asked you. And I think because it is important there are preconceived notions of Black women, of foreign medical grads, of immigrants, and you don't want to reinforce any unconscious or implicit biases.
So, as you've moved along from your medical school to residency to fellowship to practice, can you share with us some examples of mentors who have played a pivotal role in your life?
I would say my primary mentor, Dr. Angela Dispensieri. When I came to Mayo Clinic, what I lacked clearly was expertise and experience in the research method and productivity and publication. And I wanted to be a hematologist oncologist. And when I arrived, I realized that I was not comparable to my colleagues and I needed to catch up. She is a research chair now, but back then she was an associate professor. She was a woman. She was one of the earliest women in the division. So when I met with her, I told her the truth. I don't have any experience, but I'm hardworking. So if you will guide me, I need a little handholding, but I will make you proud. And she said, okay, I expect you to meet your deadlines and to tell me when you don't understand. And I said, okay. And that was the beginning of the relationship. It's been 11 years. We started as simply researchers to teach me how to be a successful researcher, but she taught me how to be a great hematologist. She taught me about time management. She taught me about critically appraising when to say yes and how to say no. And I could go to her also with things that affected me personally. I asked her for advice on a multitude of things. She came to my wedding. And most recently, our relationship has evolved so much that my husband was getting his degree, his MBA at the University of Chicago in the Booth School. And he took a leave of absence from work to do a full time. And I was in my third trimester of pregnancy. So he was gone half of the week. And so my mother was coming to stay with me, but she couldn't get the time off. So she was planning around my due date. So for week 36 to 39, half of the week, I lived with her because I didn't know how I'd get from my house if I was in labor to work. I didn't want to bother anybody. I think it'd be weird to Uber. And I had just mentioned it in one of our mentor meetings. I was like, this is what's on my mind these days. And she was like, well, I have a whole bedroom in my basement. You'll have your own entrance. You don't have to interact with us. You're welcome to stay. And I thought this was just like polite. So I was like, oh yeah, no, I'm fine. Don't worry. And then literally the next week, she's like, I spoke to my husband. He's on board. So when will you come? And it just goes to show how a relationship can evolve and grow. Like a mentor is so much more than the number of publications or the method or the medicine. It's about someone who truly invests in you and cares about you as a complete human being, not just the resident or the fellow or the doctor. And I hope that I am that mentor to my residents, my fellows, visiting medical students, that I can see them as a whole person and support them. Sometimes the greatest limiting factor is nothing to do with medicine at all. It's a struggle with something personally.
Wow, that was so inspiring. Phenomenal. I wish we could all develop those kinds of relationships with our mentors. I want to talk to you a little bit about a word that a lot of us say, and I've heard you say also, and I guess it really comes out in an interview where asked, okay, so tell me something good about yourself. And well, I'm really hardworking. And it seems to be something that everybody talks about and everybody seems to be. But what does hardworking actually mean? What are some of the differentiating qualities of somebody who really works hard compared to everyone else who just kind of says that they're hardworking?
Yeah, it's difficult because you cannot not work hard if you're in medicine. I think it's kind of like a baseline. But when I think of like hardworking, I think of the effort to complete projects, even in my fellows on rounds. Those who have pre-rounded, who aren't figuring it out at the same time that I am, who've taken the time that when I run the list, I don't have to do it first. They're coming to me, running the list and making plans that showcase that they have been working with their resident, that they know the entire team. It's about that consistent effort. It's not cutting corners. That extra effort, that consistency, that preparation is what I think stands apart.
So out of everything that you've shared with us today, if I were to ask you to define one thing you wish you knew when you started medical school or residency, that today you know is the key, what would that be?
I think if I could look back, a strong foundation in statistics. That seems odd. And I don't mean it just for research, to critically appraise the literature, to understand the odds, the ratios, to discuss prognosis, because essentially so much of medicine is the relative risk, the absolute risk, the positive predictive value of a test, the prevalence, the specificity, the sensitivity. I think that's what I wish I would have invested a little more. I help people make decisions about life or death, about money, about treatments based on relative risk, odds ratios, hazard ratios, explaining that and coupling that with their own core values and qualities. And that was not on my radar. And I think a legitimately deep foundational understanding of statistics is incredibly helpful. If I could go back in time, I would have taken every statistics class.
That's wonderful. Thank you so much, Dr. Warsame. I want to really highlight a couple pearls of wisdom that I think all of us can really take out of so many that you've shared with us. I'd say the first thing that really struck me is that rather than talk about good to great, you talked about great to incredible. And in this journey, one of the key virtues is kindness and how kindness begets kindness. I'd say the second thing that I really liked are your 3 rules. Never be late, never lie, never be lazy. You said it so simply, but a lot of the essence of your success lies in these 3 rules. And the third thing, which I really feel is essential for mentorship, is mid-cycle feedback. And I really liked how you talked about setting the expectation at the beginning of the rotation, but before the rotation ends, don't wait for the evaluation to come to you. Go in mid-cycle, at the end of the second week. Ask the attending, how am I doing? What do I need to do better? And that constant questioning of what can I do to be better? That's the engine for growth.
I think you boiled it down. I still live by never lie, late, or be lazy. And it's still an iterative process. I think medicine, you never stop learning.
Thank you so much, Dr. Warsame. To our audience, thank you for tuning in with us here on the Medicine Mentors. Thank you for joining us as we learned from the masters of medicine.